doctors from coast to coast are afraid and concerned.
I've been a registered nurse for over a decade. My hospital is in complete chaos and confusion in regards to COVID-19.
Do you feel like they were ready for this when it got to the United States?
No, absolutely not. They're still scrambling. We just don't have what we need.
Are you afraid for yourself and your patients?
Well, it's the first time in my entire career that I've ever been afraid, and I've heard other physicians say that they're afraid.
They are worried about how their hospitals and government are falling short as the coronavirus sweeps the nation. Experts warn we're not even experiencing the worst of the pandemic yet.
A lot of hospitals are asking us to keep our mouths quiet.
This physician asked us to obscure her face and alter her voice because she says she believes she'll be fired for speaking out.
We don't have enough staff, we don't have enough protective equipment, and we have too many patients.
She works in Georgia. U.S. health officials are now asking doctors and nurses to do things they haven't had to do before.
We're asked to reuse things, things that are used for one-time use only, we're asked to use for the entire day, and then we save for the next day.
If you're being asked to reuse something over and over, going to different patients, aren't you putting patients and yourself at risk?
Absolutely.
In Roseville, California, Catherine Kennedy has been a registered nurse for 40 years.
We are the front line. And if we go down, we're furloughed home, who's going to take care of these patients?
They've never talked, but both agree their hospitals and government didn't properly prepare for a pandemic. Some of the hospitals will say, look, we didn't know what this was either. This is new to us. How can you expect us to know what to do, how to prepare? What do you say to that?
Well, we were here before with Ebola. We had a protocol. And, various hospitals were ready to utilize that same protocol that they did for Ebola. But the hospital said no. They didn't want to do that. And so then at the last minute, they started scrambling.
But Kaiser Permanente, the hospital system Kennedy works for, said the procedure it's using to screen, test, and care for healthcare workers and patients suspected or confirmed to have COVID-19 are aligned with the latest science and guidance from public health authorities. These protocols and personal protective equipment have been reviewed and approved by their infectious disease experts and are in use by the major hospital systems. They said they're committed to ensuring healthcare workers have the right level of protective equipment.
I think these guidelines are irresponsible, and I think that they're playing with human lives knowingly.
You don't believe that it's now okay to use different masks?
No. A bandana is not made for, particles of a virus. It's just a decorative item, and maybe to kind of keep pollution out a little bit, but it's not meant to protect from potentially lethal disease.
And as you heard, doctors and nurses are afraid for their own safety, for the safety of their patients, and for the safety of the community, because this can spread if they indeed contract it and they're not tested. I do want to tell you this, Aaron, that we just got something from Cook County Health, which is one of the nurses worked there in Cook County. And this is from Dr. Robert Feldman, the attending emergency physician and director. And he said this in part, I wear the same PPE as our nurses. Do we look forward to the day when we are amply and have an ample supply of PPE in every hospital? We do. But until the supply chain can catch up, again, like other hospitals across the country and the world, we have instituted tighter controls to ensure that when a suspected or confirmed case of COVID-19 presents, supplies are available to protect our staff.